Welcome to HealthCast. I'm your host, Melissa Harris, and GovCIO Media and Research is here live at the 2022 HIMSS conference in Orlando. We're here connecting with top health IT leadership and to dive into the details of their work through a series of special podcast episodes with you. But before we get into our interview here today, make sure you follow along to GovCast, HealthCast, and Cybercast so you don't miss a thing. Now to jump into the episode. Here at HealthCast, we often look at the bigger picture of the healthcare space, what federal agencies are doing to aid medical providers, patients, caregivers, and more. But what does health IT look like in the care setting, especially in the urgent and transformative moment we've seen around COVID-19? Luckily, we have a couple of guests here with us who are going to give us a glimpse in how health technologies and care are coming together for patients and providers alike. We'll learn about how telehealth and health IT have been a major boon in helping providers and patients. From Harvard Medical Faculty physicians at Beth Israel Deaconess Medical in Boston, we have emergency medicine physician and director of telehealth, Dr. Orrin Mechanic, and CIO Leanne Harvey to share how their organization has leveraged remote care and improved electronic medical records, or EMRs, to make a meaningful difference in the care setting. We're here at HIMSS, and you're here to discuss some of the work that you're doing at the Harvard Medical Faculty Physicians, consortium you have. So do you want to start off by giving our listeners an idea of the kind of work you do and the folks you represent?
Sure. So Harvard Medical Faculty Physicians at Beth Israel Deaconess Medical Center is a mouthful, so we call it HMFP for short. But we are a provider organization. We're independent, but we have an exclusive affiliation with Beth Israel Deaconess Medical Center and Harvard Medical School. We employ about 2,000 people, the majority of whom are physicians, and they practice at BDMC and the affiliate hospitals of BI Lahey Health.
Excellent. And so across the conference, we're hearing a lot from, different agencies like the Office of the National Coordinator for Health IT and generally a lot about data, electronic health record, interoperability, and all that kind of stuff. But, these are greater policies we always hear about, but it's great to hear about that on the ground level. So how do you see these strides in interoperability standards and just general technological advancements impacting the way you consider EMR integration and use across your organization?
Sure. I'll tackle that one. A lot of the regulations over the last 10 to 15 years are really focused on getting everyone on an EMR. A lot of the changes had some maybe negative impacts on documentation and physicians requiring specific ways and things to document. And I think as we move out of this period of where everyone's on an EMR really towards optimization, I think the next thing to tackle is really, and what we're seeing at the ONC is the really exchanging data, making it easier, having more standards so that's easier to exchange between organizations, and we're definitely leveraging that at HMFP and BIDMC. And then I think we saw during the pandemic the shortfalls of the data collection around COVID, and so there's a lot of improvement there. And at the talk yesterday from Mickey Tripathi, and I'm going to forget I think the assistant director for the CDC was talking about the improvements that the CDC is undergoing to modernize how they're collecting and analyzing data.
As electronic health records and medical records are seeing this greater interoperability and ubiquitous use across the healthcare space, how are you leveraging those improvements with those technologies to drive better experiences for patients and providers?
We've been really focused for the last few years on, the physician experience and addressing burnout issues, because we are a physician organization, and some of the ways that we've been doing that is advocating for click reduction and improvements in the EMR that create less of a burden for physicians, including innovative ways to to, transcribe and document notes, making the burden less onerous for physicians, and anything we can do to really improve their daily lives.
Yeah, I mean, I don't think we talk about the burden piece enough. We always focus on the patients, but, clearly COVID has had an impact not just on patients, but on the provider population as well. So even though, you've been on this journey with EMR adoption, what kind of challenges have you faced? Has it been a matter of trying to skill your, different physicians so that they know how to use it, or is it change management? What are these challenges and how are you tackling them?
That's a great question. I think that, we represent so many different types of doctors. It's a multi-specialty organization, and ultimately each one has a unique expertise that needs to that the EMR just needs to aid them in the process of caring for their patient. In person, we talk about this often, you can do screen sharing. We may have an interpreter there. We may have, we may show a Punnett square for a genetic counselor and explaining diseases and educating patients and caring for them. Doing it virtually just adds another layer of complexity. And so I think COVID, in many ways, really brought those barriers in telehealth to light, because we had to expeditiously launch a telehealth platform. We tried to do this all while being cognizant that the patient is ultimately the one that needs to be most comfortable with this. We're very nimble as an organization. Our physicians were superb in jumping on the platforms and really helping their patients out when we couldn't see them in person. But really, our service is to the patients, to the families, to the doctors, and then to all the ancillary staff. This has to be a seamless workflow to really do it effectively. And I think we're able to accomplish that, which was great.
I would also add that, Beth Israel Deaconess Medical Center has a homegrown EMR, and that is developed and maintained by the staff at BDMC. And our physicians are used to the partnership that we have with the medical center, and it's really a lot of collaboration between the two organizations, and so they really feel heard in when changes need to be made, and certainly during this telehealth journey.
And they were heavily involved in the process. Physicians, other clinicians, patient advocacy groups. We wanted to create a system that was sustainable for the future of healthcare, and all while prospectively designing it as a system that we really felt would service our patients the best. We could talk about that a little bit later too.
Yeah, I think that really brings in the aspect of human-centered design that we've been hearing about recently, really working with the users so that, you're not just building something for the sake of building something. So, while you do have this EMR standing up, how else do you see the realm of interoperability improving? What else do we need to do so that the experience with EMRs and their use across the healthcare space really making a difference beyond what's like right now?
I think it's important to get the critical information at the fingertips of the clinician when they need to make decisions, and I think that's been something that has been really difficult. And, there's certainly the growing pains of, all the data. There's tons of data available now. How do you sort through that and figure out what are the pieces that you need in order to best care for the patient? So I think there's a lot of improvements that could really support the clinician side of patient care.
And in parallel to the EMR, we also then have, RPM, other synchronous platforms, all these other wonderful, devices and vendors that are really ingenious solutions to our patients. Trying to figure out how do we kind of coalesce all that information to something that is centralized, well understood by the physician, where we don't have to kind of undergo a different training, have to undergo a different external solution. So I think those are the things that are going to be invaluable to success for the healthcare system.
Yeah, going back to the whole aspect of telehealth that you were talking about, before COVID-19, telehealth was really emerging as something that some people were looking off into the distance for, but it came to us really fast with COVID. It became an essential part of how we deliver care. So what has telehealth care looked like at BDMC throughout the pandemic and even beforehand? And as we start to reopen to the world, how do you see telehealth across the healthcare space evolving in maybe a more hybrid model or in a way that is integrated into the clinical care space?
That's a great question. We were very fortunate in many aspects. So prior to the pandemic, I was the director of telehealth at Harvard Medical Faculty of Physicians, which again, we're the physician organization that staffed that works at Beth Deaconess Medical Center for their patients. And it was really a very wise suggestion by our CEO, Alexa Kimball, in investigating telehealth and looking into it and seeing how we could really aid our patients through telemedicine. And so that role was actually existed prior to the pandemic. And in that role, I had actually launched, along with, the chair of emergency medicine and Dr. Kimball, a telehealth platform, and Leanne and many others that helped. And this telehealth platform was called BDMC On Demand. And so the idea with this, and this is in a time where we didn't have any parity solutions, or not many parity solutions, meaning couldn't really get a lot of reimbursement, but we felt like we needed to design a platform and take care of our patients that may have been in the community, may not need to go to the emergency department. It could decrease crowding, which, almost every emergency department deals with, could bring just a really nice solution to patients who had really straightforward answers. Patients are just know themselves, as I tell everyone this, know themselves better than us as doctors do, and oftentimes just have something really quick, and we can keep them at home or keep them at work, keep them with their kids. And so we actually created this. We used a vended solution for that, and that's a little different than what we did during the pandemic, which we created our own solution. And so using that vended solution, we just launched this for the state of Massachusetts. We actually made this at no cost during the pandemic in an attempt to really help folks quarantine, learn about COVID. We had our doctors just on demand for them, and aid with crowding in the emergency departments. So we really thought already, before the pandemic, we had already, thought about workflows, thought about physician scheduling, thought about, governance. We had a lot in place, which was really fortuitous for us, I think, and aided in the process. When COVID hit, we were able to launch that pretty quickly in a matter of, days to weeks, really.
Did you see that adoption during COVID really making a difference in the whole clinical care space at the hospital? I know that crowding was an issue. Some people were afraid to go to the hospital. So how did that look like at the care setting?
That was a huge impact. I mean, in the early days, we were doing probably 70% of all outpatient care was through telehealth. And then it's really stayed, and even at this point, it's about 12%. So we're still doing a fair number of telehealth visits, and it has made a huge difference. And certainly, primary care is a huge user of telehealth. Psychiatry, they've really continued to leverage video visits for their patients, and they found a decrease in no-shows. So this is leading to better care.
Absolutely. And we've implemented, when I say we designed this prospectively, we really worked hard on making the consents multilingual, to making interpreter services available, all to increase access, reduce health disparities. And so we're measuring that prospectively, really trying to figure out what are the pain points now, and where are we actually alleviating burdens in healthcare. And so I think that we've still sustained a good percentage of our population with telehealth, and I think that that's going to be here to stay.
Speaking of things that are here to stay, there's telehealth, but generally, where do you see technology driving the future of healthcare delivery? I mean, here at HIMSS, we're talking about reimagining healthcare. So how can we make it faster, more accurate, accessible? What things do you see coming into the care space?
So I think I see two big buckets. I see one which is like pie in the sky, what needs to happen to modernize the healthcare system, what I'd love to see in 5, 10, 15 years. The second one is really what still needs to happen. You know, I fear, at least, I'll speak for myself, I fear that, parity in reimbursement is going to go away in some aspects. And that fear, I think, is substantiated and real, and ultimately is a disservice potentially to our patients. And suddenly we're thinking about all these great ideas that will happen in 5 to 10 years. We have the technology, we have the minds that are conceptualizing this. But if we can't provide just that synchronous care to patients who are otherwise pretty marginalized, I think that's where that's going to be our biggest obstacle. Sorry, Leanne, I know you had something probably more wise to say.
No. I think we're going to see the push to more patient/consumer focused delivery of care. And I think the pandemic and the use of telehealth is one of the ways that we see that patients really like telehealth. It's convenient, and you don't always need to be in person to get good care. And I think that organizations that can continue to offer telehealth to patients where it's clinically appropriate and the patient wants to do telehealth, those organizations will be better able to, care for their patients and hold on to those patients. And I think some patients will decide to find other organizations or providers to seek care if they can't get the type of care that they're looking for. And we certainly see that in some of the newer companies like, Firefly Health and, One Medical. A lot of these organizations, telehealth is a big part of what they do. And it gets to are using the resources to the best of at the top of their license. So you're not always seeing a clinician. If you don't need to see a doctor, you can see a mid-level, but getting patients care they need when they need it, which is a challenge. I mean, our organization has issues with, access. How long does it take to get an appointment? And I think if we can start to reframe, what patients could have telehealth, what patients need to come in, that can help improve access, for example.
I'll give you an example. There was a small company that actually had a dermatoscope, which can actually, a primary care physician or a medical assistant, or really anyone can be trained on this for any, concerning lesion that a PCP may see, and essentially take a picture. And this goes, it actually goes down to the layers of the skin, does a pretty good image, and can send it to a dermatologist with pretty quick turnaround. And which is such a service to our patients if we're able to do this from primary care clinics. And unfortunately, as much as this is reimagining healthcare and really providing care to patients right away at identifying a concerning lesion like melanoma or something along those lines, the reimbursement wasn't there. And ultimately, the payers, in my opinion, aren't partnered in providing that reimagined care. I think that may be our biggest barrier going forward to this.
Yeah, I mean, sometimes it's not even about the technology. It's like a lot of culture, people, processes. So I want to pick your brains on HIMSS a bit. You guys both spoke here. And so for people who perhaps didn't make it to your session, or if you want to just really drive something home, what are one or two takeaways that you want to let the HIMSS audience know about why you came here?
I'll jump in. I think the takeaway from my aspect. So we co-speak for those that don't know. So Leanne Harvey is our CIO and has really led the telehealth kind of expedition at our organization. I'm the director of telehealth and also a physician, and so we have two very unique and different angles when presenting Mine is this, and that is that you have brilliant minds at your institution, and really, if you let them innovate, which I think our organization let our physicians innovate, you will find some ingenious solutions. We had robots being used in the emergency department. We were 3D printing nasopharyngeal swabs. We had hackathons that we hosted with folks from 44 different countries. And all that to say is that is doable for every organization if you just kind of give them the tools to do so and the encouragement. And from that, we launched a telehealth system that's, essentially homegrown, within the workflow of our physicians, our interpreters, multiple languages, and we've had over 500,000 visits in a short amount of time. So I think that's all credit to our organization and everyone that's a part of it that was empowered to innovate.
Yeah, I think for me, one of the takeaways from HIMSS was just it's been a really nice way to reconnect and also hear what everyone's been doing over the last 2 years, because we've all been really heads down, just trying to support our organizations and doing a lot of innovation. And it's been really amazing to hear from all the different sectors, whether on the, the vendor side, other organizations, the federal government, about their perspectives on what has worked, what hasn't worked, what do we need to build upon going forward. And so that's been really exciting.
Fantastic. And I guess that just leads me to my last question, which is, even though the theme of the conference is to reimagine care, what do you think are some of the really big themes you're seeing across the space? Health equity has come up, accessibility, using data better. But what are you seeing across the conference, and what's standing out to you?
Sure. So I would echo, health equity, and that was a big core principle that we designed around for the telehealth platform. Is we wanted it to be accessible to anyone who wanted a video visit. I'd go back to, consumer focused healthcare and that giving patients that, and there's that line between, is it a patient, is it a consumer, when is it a patient, when is it a consumer? But I think people really have a different expectation of how they want to receive care, partially through how they received it through the pandemic, that we have the opportunity to really capitalize on and move forward and kind of think about things differently. I mean, at HMFP, we have another initiative that we've been working on for the last year or so around improving the patient experience around payment. And so I think a lot of these themes I've heard echoed through the conference is the focus on the patient.
Mm-hmm. Yeah, I completely agree. We need to focus on the patient. I love this. I love this whole modernization of healthcare and what we see with reimagining, and I get inspired seeing what other organizations are doing, and finding out, systems to improve our own telehealth workflow. We talk a lot. We implemented a patient navigator, for example. We're so excited to talk about, utilizing someone who has otherwise not been in the healthcare system, but really just to be that bridge between patients and clinicians and staff. And so I love seeing how much, we're going to move forward in the next decade or so. And I think it's all here at HIMSS.
Yeah, it's very exciting. So thank you both for joining me on HealthCast, and I hope you guys enjoy the rest of the conference. I know there's a lot going on, so I hope you walk away with some great insight.
Great.
Awesome.
Thank you.
Thanks so much, Melissa.
Thanks for tuning in. Follow our other shows for more coverage throughout the conference this week. And head to GovCIOmedia.com to keep up with our HIMSS coverage. We'll be covering some key sessions and we'll release daily newsletters so you don't miss a thing.
HealthCast, along with GovCast and CyberCast, is a production of GovCIO Media and Research. For more podcasts and to check out the other shows, head to GovCIOmedia.com. Watch out for new episodes released every Tuesday and Wednesday across our shows. You can follow all of them in your favorite podcast platform, and if you like what you heard, make sure to let us know by leaving a review. And if you have any topics you think we should look into, contact us at newsletter@gcio.com.